It's time for Medical Moments with Covenant Healthcare. Today we're talking about smoking and how to quit the dangerous habit. We're here today with Ann Worley. Thanks so much for being here with us today.
Hello.
Hi. All right, so first of all, if someone is a smoker right now, what do you want them to know?
Well, anything you can do to quit is great. Anything you ingest into your lungs obviously is going to cause harm. And I think part of the thing is people feel like they can use the vaping or the e-cigarettes to quit. And really, it's better just to try to quit altogether than use that as a crutch.
And that's, you know, in the news a lot right now too, some effects from that. But let's talk about how quitting smoking can be really hard, especially without some resources. But Covenant's there to help. So what do they offer to help people quit?
At Covenant, we have a smoking cessation program that meets 3 times a year. And our next class, you'll see these flyers up in our facility. Our next class starts on September 19th. We will have that run by a respiratory therapist. They will test your lung capacity on a baseline level and give you a report of that. And then at that time, if you want to sign up for the next 4 weeks for a class with us, you're welcome. If you want to try it on your own and come back maybe in 3 or 4 months, if it doesn't work, that's great. I think the important thing for people to remember is many times it doesn't happen on the first time. Sometimes it takes more than once to quit.
As long as you're trying, right? So we know that smoking puts us at risk for lung cancer. Can you tell us more about the lung screenings?
Sure. At Covenant, we have for patients who are smokers and former smokers who are between the ages of 55 and 77, and they must have a long-term smoking history, about 30 years, a pack a day. There is available a lung cancer screening. It's a short test. You lay down on a table. There's no IV, there's no dye, there's no prep. They run you through the scanner and you come out. We are able to see a 3D view of the lungs, testing for lung cancer, which is more effective than just your standard chest x-ray.
So if you're interested in these classes or the screenings, what should people do, you know, to get some more information on that?
Well, you can call Covenant. My number is 989-583-5014. My name is Ann. I'd be more than happy to talk to you about these. You can also touch base with your family physician. They can talk to you about our resources, and there's resources on our website.
You know, this seems like an obvious question, but you know, why is it such an important thing to stop smoking?
Well, the lung tissue is fragile, and even if you only smoked a little bit when you were younger, sometimes that damage builds up into scar tissue later on. It's really important that at any point in time, if you can quit to minimize the damage both now and long term, you're really doing yourself a favor. The lungs support a lot of other systems. Poor lung function can be responsible for some peripheral vascular disease or poor circulation. It can also be a contributor and have issues smoking can with diabetes and all sorts of other health problems. So really it's one of those things that really does affect more than one system in the body.
Yeah, it's an important thing if you can try and quit, right?
Exactly.
Well, thank you so much for being here with us today, and such great information. And if you at home would like to learn more about the classes you mentioned or the screenings, you can find some more information in the hot link section on WNEM.com.